Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University with a joint faculty appointment at Ross University School of Medicine. And in this video, I wanted to go over Mental Health Awareness Day. Now, Mental Health Awareness Day took place on October 10th, which is about 11 days before this particular presentation is being given. But what is more important and alarming is the fact that this is on the rise. Mental health illnesses, especially anxiety, depression, and only about 30% of depression is actually effectively treated by medications. The other 70%, unfortunately, is untreated. So quite a few quotes that I wanted to pick from. One of them, especially if I could have a conversation with my younger self, I would say, "You're not weak, fragile, or broken. You're strong, capable, and resilient." So, ways to remedy the matter. Well, understanding that public health borrows from sociological concepts and the roots are in early 19th century, and geospatial considerations are essential. It would behoove us to further explore some of these remedies. So when we're thinking about mental health, psychiatric epidemiology, the currents and distribution of mental health and behavioral disorders across people, space, and time, these are increasing. And so it's important to examine the causes and consequences of these disorders in order to develop interventions or understand the risk factors, and then providing more effective intervention strategies for treatment. In this slide, we further go into a treatment method which was up and coming about 10 years ago, but really has escalated and taken full pace. As we all know, Alcoholics Anonymous, or the 10 steps, the 12 steps that have been provided, the program has very little scientific evidence-based approach. This, on the other hand, has been studied, and the intervention has been effective in many people. So if you haven't heard about this, this is a substance use which is important, extremely important to train paramedics and police officers to deal with psychological crises. So many times due to the training in the legal system and the policing, it's more important to have a mental health approach which is much more conversational, and having to come up with a plan of action where the patient feels empowered. Now, when we're thinking about psychiatric epidemiology and the individual patient here, oftentimes it's challenging to try to collect that social history and for police officers to handle this, but because a lot of times the situations become hostile very fast. So the solution here is to, in crisis situations, is to stay calm and be aware of your environment, and then a first aid sort of approach. Now, there's a course called Psychological First Aid, which I encourage each and every one of you to take. It's actually a Coursera course, and it does cost a bit of money, but it's worth it, and it provides more information how police officers can get trained in the area of using adequate force. Thank you for listening. So before I end this video, I wanted to revisit this map that I created in ArcGIS and geospatial software. And What it's trying to show is that the lighter values, there's higher rates of mental health providers rather than the darker areas. The darker areas have poor mental health providers, and so this can allow for better understanding of areas where interventions like SBIRT should be implemented. These darker areas are where they're needed the most. So all of Georgia pretty much has much lower mental health providers than, say, California, where there's a lot more. So this is another portion of mental health awareness that I thought was especially important. And so if you want to learn more, NAMI has a good website, and then others, if you need help or someone you know, then there's also always crisis text line 741-741, which you can maintain anonymity and still be able to interact with them. Additionally, you can also be a part of other organizations, SAMHSA, and others who release a plethora of information in mental health awareness. Thank you for listening.